Valvular heart disease is a national epidemic, with over 50,000 patients requiring heart valve surgery per year in the United States. We all are born with 4 heart valves, and any one of them can develop a blockage or become leaky. We at UC San Diego Sulpizio Cardiovascular Center offer the full range of diagnostic services to make that diagnosis. This includes echocardiography, CAT scanning, and invasive hemodynamic measurements.
Most patients with valvular disease will need some kind of an intervention. You could only treat it for so long with medication, but at some point they will need an intervention.
I was really atypical. I didn't realize how bad I was. When I would walk the street, because I generally walk 2 miles 3 days a week, I would cut down to maybe 1 mile.
When Matt came to us, he had significant aortic stenosis, and he had significant shortness of breath, even walking on flat surfaces. And in fact, he was having slight problems with the dimension of his heart, and it was time to really fix that valve. And what we found out was Matt is actually very healthy otherwise. His heart is perfectly normal, he has no coronary disease, and he was the perfect candidate to consider minimally invasive operation, which is what we did. We put him on heart-lung machine, we took his valve out and put a new valve in its place, all through a small incision between his ribs.
My recovery was ideal. I was alert. I was fighting to get out of the ventilator. And indeed, within an hour and a half, I think it's a record, the ventilator was out. And from then on, it was downhill. I had very little pain. And the next day, I was up walking, and a day later, I was released. I was back to work within 10 days of the surgery. And how I'm made today? Let's put it to you this way. I feel like they gave me a new 8-cylinder engine.
I just teed off on the golf course and started to walk down the fairway when I completely went out of breath to the point where I thought I was going to faint.
When Don came to us last year, he came in because he was having worsening shortness of breath. It was getting so he wasn't able to walk much without having to stop to catch his breath, and this was new for Don. The heart murmur that he'd had for several years was now much louder. We did an ultrasound of his heart, and sure enough, his aortic stenosis had become severe. Bad enough where this was going to be a threat to his life if we didn't fix it. After some discussion with the whole team, and also because Don had had previous heart surgery, we felt that the risk for repeat surgery would be fairly high.
We decided that the best approach for Don was to replace his valve percutaneously through a catheter that goes through a very small incision on the left side of the chest through the apex of his heart, what we call transapical aortic valve replacement, which is done with the heart beating without the use of cardiopulmonary bypass machine, and he did great.
Recovery was remarkable. I was only, I think, 4 days in the hospital. I'm able to play golf and without any problems. All my regular activities are pretty much the same as they have been for the last 20 years or so. And I have absolutely no complaints and nothing but good things to say about my life. I've been a lucky son of a gun.
Valvular heart disease affects patients of all ages, and the interventional treatment options include balloon aortic valvuloplasty and transcutaneous aortic valve replacement. Balloon aortic valvuloplasty involves placement of a large balloon across a stenotic or tight valve, and which is then inflated to open up the blockage. This works very well in young patients, like a recent 21-year-old UCSD undergraduate that we treated. He was born with congenital pulmonic stenosis, and that progressively got worse to where he developed shortness of breath with minimal exertion. He came to us and we successfully treated his pulmonic stenosis with balloon aortic valvuloplasty.
What we can offer at Sulpizio Cardiovascular Center to these patients are a variety of options that are tailored specifically for them and for their disease. That includes, of course, the traditional approaches like traditional open heart surgery, also minimally invasive approaches that include robotic. And what that means is that we're still doing open heart surgery. We're just not going through the sternum, doing the traditional incision through the bone. When we do these valve procedures, it's really like running a big symphony, and everybody has to be really in tune, work in concert, because the moment where we deploy the valve is a very crucial moment, and we only have a few seconds to get that right and get it in the perfect position. So it brings all of us together. It brings almost all specialties within the Cardiovascular Center together to be able to offer such procedures. I don't think you can find any other team across the country who works together so well as we have within the Cardiovascular Center.